Dear brothers and sisters, pilgrims to the Holy Land, Assalamu alaikum wa rahmatullahi wa barakatuh. And congratulations for this great blessing that Allah has given you, which is going for Hajj. We'll be talking about people with chronic diseases going to Hajj. They should be having some special care and special preparations for the Hajj. Of course, you should be visiting your doctor sometime, maybe a month before going to Hajj. You should be asking him for adjusting your medication, for prescribing you which medication should you take, either to increase the doses or to decrease the doses. And you should have a medical report from your doctor stating what's your condition and what drugs are you receiving, and make sure that the drugs names are not in the names that you buy it from the pharmacy, but rather the generic names, so that names of the drugs change from one country to the other. Maybe in your country the name of the drug will be different from that in the Saudi Arabia if you have to buy it from there. And of course, you should have a card with your name, which is usually all the pilgrims would be wearing it. You should state, or the card should have the disease that you suffer from, should be written on it. May Allah forbid that you have some problem or some crisis with your disease, the diagnosis will be known. Of course, there are many diseases, and many of them are having different aspects or different ways of treating them. But generally speaking, you have to have all your medication with you. Some of the medications are forbidden to be taken either on board or to be going into the Saudi Arabia. Generally, those which have some sedatives or some drugs like codeine or something like that, you should have the prescription from your doctor that you necessarily have to use this drug, or else you will not be allowed to take it with you. People with cancer or problems like that, or low immunity, should report that and should be taken care of. Maybe you should have your wheelchair if you're not being able to walk for a long time. Let's talk about some specific diseases. The people with heart diseases, people with hypertension, people with problems like lung diseases, all of them should not do excessive effort. They should have the wheelchair. They should have somebody to assist them in walking and doing the tawaf, or going around the Kaaba, or the sa'i between the Safa and Marwa mounts. And of course, you should have somebody either through their campaign or with you personally, the blood pressure measurement device, and should have a good and a very good nutrition that would help you to go and perform the Hajj. And of course, you should have enough amount or plenty of water, unless your condition forbids this. You should have lots of water to avoid having stones or avoid having sunstroke, because the heat there is very high. You should have your creams, you should have your ointments, and you should have your, to avoid the skin crackling, and when you walk you should have good sandals. Maybe you should have on the sandals the silicone attached to them, the silicone pads that would make your walking easier. For those people who would have asthma, I would recommend that they would have the inhalers, extra inhalers with them. And for those people who would have chest disease, they should have the mask on all of the time. We wish you a very pleasant time there. May Allah accept your deeds. May Allah accept your du'as. And please make lots of du'a for myself and the crew here in Huda TV and all our families. Until we meet you again, Assalamu alaikum wa rahmatullahi wa barakatuh.